Welcome to the Yellow Chair Collective podcast. I am your host, Soo Jin Lee, the Executive Director of Yellow Chair Collective. Today, we're joined by Cover California's Chief Medical Officer and Physician, Dr. Monica Soni, in celebration of AAPI Heritage Month and Mental Health Awareness Month. Welcome, Dr. Soni.
Hi, thank you so much for having me.
Welcome, welcome. We're so excited to have you. I met you actually in Chinatown in LA. I don't know if
That's
you
right.
remember.
Yes.
Yeah, you were here. I know that you are such a huge advocate of our culture, heritage, and healthcare within our culture and heritage too, to bring awareness. And so I'm so excited to have this conversation with you today.
It's an important conversation to have, so really thrilled to be with you.
Yeah. The work that we do, of course, is mental health care. But of course, beyond mental health care, just overall wellness, emotional well being, and physical well being is all connected. And so we'll be diving into a little bit of the challenges and struggles that our community is facing as well. And I'm sure that we have a lot to talk about here.
Absolutely.
Well, for starters, for the listeners that may not exactly know who you are, would you be able to give us a little bit of your background information? And also, how did you become the Chief Medical Officer of Cover California?
I ask myself that question not infrequently, and I feel very grateful that I have the seat that I have. But yes, let me share. So I am an internal medicine physician. I trained in primary care, which to be honest it's really the only thing I could ever imagine myself doing in medicine. It's that longitudinal relationship, very trusting, bidirectionally intimate relationship that brought me into medicine. And I've spent most of my career working in community, mostly in Los Angeles, but also spent a fair amount of time in my training in San Francisco and in Boston. And just that kind of community embeddedness and deep work. With folks that I really cared about is what I spent most of my career doing. But as you mentioned, not all parts of the system work that well. And so increasingly, I started to ask myself, I'm doing, I think, pretty good one-on-one, or maybe even for the panel that I take care of. But they're really struggling to get that specialty care, or they are having challenges getting their insurance to manage something, or things are just too unaffordable for them. And so that felt like whole person care too. I needed to find ways to tackle that. And so I was able to work increasingly at scale on primary care for all Californians. So that really brought me to my seat that I have right now at Covered California.
It's incredible. I think for us within the mental health care system as well, we're always feeling like we're kind of fighting with the system, and people always talk about how hard it is to try to access care. And so we really appreciate you for taking the seat that you have and knowing that this is such a huge challenge for our community.
Yes, it is critical. And I think, I use the term whole person care, and I mean that, right? As a primary care provider, there's no distinction between physical health and physical manifestations, mental health, behavioral health, substance use disorder. All of that is critical to the wellness that we all seek.
Absolutely. Well, let's dive into some of our cultural elements. Yeah. We're really talking about and trying to celebrate our API Heritage Month here today. And so, just broadly, what does wellness mean to you when you are specifically thinking about the API communities?
Yes. To me, it is not only individual, like we said, comprehensive care from top to bottom, from inside out, but also the family, also the extended family, not just the nuclear one too, and making sure that everyone is able to take care of themselves and their loved ones as well. Maybe I'll share a personal story, which is my dad's side of the family is from India, and we have a lot of just cardiovascular risk factors. So all my uncles and my grandfather had triple bypasses. And when my dad, we're sort of all waiting for this to happen to my dad, even though nobody smokes, nobody actually has diabetes. It's really these strong genetic factors for South Asians. And he had chest pain and drove himself to the emergency room during his heart attack.
Oh my goodness.
Yes, walked in, went straight to the ICU, got great, great care there. When it's time for him to be discharged, he also insisted on driving himself home afterwards, and we followed him behind in our car. And that's also part of the cultural context, right? The
Mhm.
stoicism,
Yeah.
the idea that you can really manage all the way up to the edge. And so I think talking about how to communicate that it's okay to ask for help, it's important to ask for help, that's part of keeping yourself yourself well, whether that's your family or other care providers, I think is really important. So I think this month for API Heritage Month, it's great to celebrate our resilience as a community and also acknowledge that there are barriers or opportunities to improve.
Yeah, absolutely. I think every year, when May comes around, we are holding space for both, that there are so many things in our culture and identity that we would like to highlight and celebrate. And at the same time, that we do come with a lot of different baggage and trauma of our own with our cultural identities as well. And sometimes it can become a barrier to actually receiving physical mental health care that they really need. And so we have a lot of, at our practice, eldest daughters that are calling on
Mm.
behalf of their parents to seek help for them. So this is kind of a trend and a pattern that we've kind of witnessed within our own little field.
Yes, I am not the eldest daughter. I have a sister, an older sister, and I try my best to share her burden.
As an eldest daughter, I appreciate that. Look at these family dynamics that we live with, huh?
Yes,
I think a
exactly.
lot of listeners can really relate to your story as well as what we're talking about. Some of the key things that we're noticing within our family dynamics as an Asian American culture, or even just more even broadly, immigrant family members as
Hmm.
well. Yeah.
Yeah, agree.
May is also Mental Health Awareness Month. So, coming from a physician, I think, mental health clinicians ourselves, we feel like we are advocates sometimes of our clients and having to reach out to physicians very multiple times, like nurse practitioners. We got to chase them down sometimes.
Oh no, I apologize on behalf of all of us.
And trying to make sure that there is that connection, like the whole body care that our clients are trying to receive. And so would you talk us as a physician side about mental health and why is it so important?
Yes, I'll do it on a couple prongs. One is, maybe the just the evidence. The evidence is clear that the interplay between physical health and mental health is so strong. I would say so strong. There's no clear line between the two, right? Folks have more challenging outcomes or worse outcomes with their chronic diseases if they are also struggling, connect on a comorbid level from mental health or substance use disorder. Cancer outcomes can be better depending on someone's sort of spirit and energy and how their mood is. So just from just that first level, the evidence is clear. You can't just take care of one and not the other. And then on the other side, I think sort of the inverse is true as well, right? We know that actually physical interventions, exercise, going outside make a difference in mental health as well. And so, again, the interplay is very, very strong. I think the more that we can, as a professional group, work hard to not make distinguish between the two and work as in a continuum of providers that are here to support whatever the care needs may be of someone, the better we're going to do for the population that we serve. So it is really critical. And we know that there are real disparities and differences for folks that identify as Asian American. I'll just share some of our data. When
Mhm.
we looked at behavioral health visits, across our entire population. And we serve over 2 million Californians across the
Mhm.
state. We saw the lowest rates of behavioral health uptake were in folks identified as Asian or Asian American.
Mhm.
And that was regardless of region, income, language spoken. It was really this very strong finding.
Yeah.
And we can talk about stigma, we can talk about access, but I think first we should say that's a disparity we don't think should persist. And we all need to be working to close those gaps.
Yeah, yeah. Well, we'll talk a little bit about some ideas of how we can close the gap in a little bit as well. But I appreciate you again. It's such a confirmation coming from both you as a physician to be able to talk about some of the statistics findings and just the fact that wellness in general, again, whole person wellness is so important, and we should not be differentiating between like body care and mind care.
Yes, agreed.
Yeah. Well, for our listeners, especially our family members, maybe the eldest daughters that are carrying all of these family expectations and pressures, this is like one of the top number one thing that we hear. We specialize in working with Asian and Asian American folks, especially a lot of immigrant family households, that we hear this a lot. There's a lot of burnout and family expectations. They're trying to balance so much, not only for themselves and their identity, but an extension of their family and their extended family is represented about their success as well, right? And so they suffer a lot in silence and they suffer quietly. And so when do you think is a good time for them seeking help and what kind of help should they be seeking?
What a fabulous question. So I would say anytime you're not feeling your best. And that sounds a little bit simple and maybe a little bit reductive, but it shows up in so many ways, right? This can show up in physical symptoms, right? You're having headaches, you're having abdominal pain. It can show up in sleep disruption, right? Reversals of sleep cycle or wake ups. And then of course it could show up in kind of classical mood disturbances or challenges that you're facing at work or at school or friction in the family. Those are all signs, right? Your body is trying to give you signs that whatever is happening needs to be modified. And so I would say if you are feeling any of those, just it's not your best, you're not yourself, it's time to reach out. And I think there's so many doors that can be the right door depending on how comfortable folks feel engaging in the delivery system, right? They could go straight to you all, right? And find a provider on that front. Primary care, is a great front door too to help people make sure that we are, diagnosing the issue correctly and getting them to the right care plan and treatment plan. But I would say if those pieces feel intimidating and hard, if there is someone trusting in your life, a friend, if it is a family member, start there too. My challenge for everyone is not to hold it inside and bottle it. That's the path that we want to avoid.
Yeah, I love that you emphasize that because I feel like we, as mental health care providers that are specializing in working with Asian and Asian Americans, it's almost like the end that they're trying to find us, right? When there is a crisis that they're looking for a provider. And I know that this is not just mental health care in general, it's more of just all across the board that when they are so sick that they cannot do anything about it, at that point is when they're seeking providers of specialists or just hospital in general. And so I feel like this is a theme that I see a lot for our community.
I want to just double down on that, right? Seeking care is not a failure. It
Uh-huh.
is a critical part of taking care of health. And honestly, I think you might agree with me on this. The sooner you can make it to one of us, right? The sooner we can get you back to doing the things you love and care about. It's often the most efficient, most effective way to get back to yourself.
Absolutely. So I know that people have a lot of questions about healthcare, coverage and things like that in general. It can feel a little bit daunting. I have to be honest. We also receive a lot of questions about healthcare coverage, and we're making multiple calls, trying to be that bridge. We have case managers that are trying to be a bridge and making sure that people understand what their coverage actually looks like as well. And so, how can healthcare coverage support someone that is just trying to make that first step in mental health care or even just preventative care?
Yes. I think we know that when folks don't have coverage, if they are living uninsured, that in and of itself is a barrier. We're afraid of how
Hmm.
much it might cost us to access care. We might be crashing into services through the emergency room, the most expensive, access point that we have across the delivery system. And so I think we definitely know that the opposite is not the path, right?
Yeah.
That sure is clear. Now, you're right. Just because you have an insurance card doesn't mean it's super easy and friction free. But I do think this is where all of us can do our part to try to help be navigators of a sort. So, one thing I want to call out for everyone to know is with the Affordable Care Act, part of the law has changed. Preventive care and screening for behavioral health needs are free. So, you cannot be charged for those things. And that I know is a common misconception, or frankly, I'll tell the truth. I got charged the other day by my practice for some labs that should have been free. And I had to go back and be like, I'm pretty sure this is free under the Affordable Care Act. And then they had to go and waive it. Well, I'm the chief medical officer at Covered California, and that happened. Right, so we know that this is happening across the board. So the system makes it hard. I want to own and acknowledge that. But I think if we know, right, yes, I can get all of my cancer screenings that are recommended for free. I can get screened for chronic diseases. And as part of that package, I can be checked to see, okay, well, what is my anxiety level? What is my depression level? Do I have risky alcohol use? All of that can happen in an encounter with insurance coverage for free. No copays, no deductible, no co-insurance. So I will say that I really try to drive that home because you already have, if you have coverage, you've got that insurance card, use it, get some value out of it.
Absolutely. You know what? This is you said the word free so many times and I'm like, yes, this is speaking to my community right now. Do you hear that, people? There are free screenings. You better take an advantage.
Absolutely.
Just hear that word free, give it to your mom. This is free.
Don't let it go be wasted. It's reserved for you.
Exactly. This is good shopping material right here. Get screening, people. I am so happy to hear this news because honestly, I think we have this stigma around like the usage of our healthcare system. Also, that it just comes at a such big price tag every time we just visit the doctor. But that's comes out of also not having enough information about the healthcare system too. And so then we end up just blaming the system, exactly not knowing what we have access to either.
Yeah, I mean, it's just like you said, right? We know how to haggle in a lot of parts of our life. And
Mhm.
sometimes we don't bring that same energy to the healthcare space because it's built in really challenging ways, but you can, right? I was haggling over my labs. I was like, I don't think I have to pay for that.
Hear that, Asian moms? Just be you. Show up as you. Yeah, ask for that screening and be like, "Hey, Doctor Soni said this is supposed to be free. I've covered California."
Please drop my name.
Amazing. So a lot of, the folks that we see are young adults and they might be freelancers, they might be creatives. We have the Hollywood right here and they're working professionals, especially in their 20s to about fees, and they might not exactly receive insurance through their employers. And so I think they're also just trying to navigate what that means. And so would you tell us a little bit about what they should know about Cover California for these folks?
This is a very common population that we serve, right? Folks that are maybe contract employees or independent gig workers, whatever it may be. And, some folks are lucky enough to stay on their parents' insurance until they age out, right, at 27. And then all of a sudden, you have to fend for yourself if you've been lucky enough to be on your parents' insurance. Really, this is the exact age range and folks we want to engage at Covered California, both because, sometimes you might have a good month and make good income. Another month might be really difficult. That's the perfect set of folks where we can get you affordable coverage, right? You come here and we can make sure that we find the right plan for you within your budget. And as we talked about, it's never too early to start taking care of yourself and making sure that you're getting all the things you need. I mean, frankly, breast cancer screening, colon cancer screening, these are things that start in your 40s. This is not something to be deferring or waiting until later. Similarly with the behavioral health. So all of this is work we want to be doing before it turns into a crisis or in terms of something more critical. So, coveredca.com, we've got tons of information. This is exactly the population that we're in part built for.
Yeah, yeah. Speaking of like some of these cancer screenings, this wasn't part of the list, but I just thought of this. A lot of our folks, they have a lot of anxiety about getting the screening because they're having this anticipatory anxiety about what if I actually get diagnosed? So then they try to avoid the screening altogether because of the anxiety. Is there anything that you would want to tell our folks that are suffering from that anxiety?
Yes, I would. I totally understand it. First, yes, I totally appreciate that that is a real experience and feeling. And maybe, hopefully it's not TMI, but I will share that I went to get my screening mammogram as I was supposed to. And the first one was abnormal. And so I had to come and get some follow up tests. It's all fine, ended up being normal. But yes, of course, there was anxiety related to that. However, now I have a radiologist and a team that knows exactly what my body looks like and is able to monitor me as my risks might be increasing as I get older, which is what happens with most cancer. Most cancer, the risk increases as you get older. So I would say, it's a little bit of challenge in the moment or a little bit of, I don't like to use this word, but pain now, but really reward later. I mean, that's really what we're setting ourselves up for right now.
We were just talking about the anticipatory anxiety and how that might be preventing people from getting the help until, again, going to the crisis, right? And so then that's the point where people really sometimes there's not a lot of answers either at that point. And so I imagine that, the anxiety at that point is going to be much greater than trying to get the screenings done from the get go.
Well, that's exactly right. And that's the difference between a true screening test and a diagnostic test, right? The point of the screening test is you're low risk. We are trying to prevent something from really impacting your life in a negative way versus waiting until you feel something or something feels abnormal. The probability in that circumstance is that there is going to be something that we need to hunt down a little bit more. It's hard. We feel the way we feel. Health system's a little bit scary. I don't want to diminish any of the feelings, but I do encourage folks to try to access the services early on to prevent that, sort of downstream consequences for us all.
Yeah, absolutely. I think part of the mental barrier sometimes is also just kind of our cultural identity of like, well, we should be taking care of ourselves. Like your beginning of your story was exactly that, right? That we don't want to be screened for anything or ask for help at this time because I feel fine, which means I should be fine. I'm just like trying to live up to this perfectionistic idea of part of me, right? And so feel like letting that go and perhaps, I feel like some of those pressures are also causing us to have so
Mm,
many issues as well. So
strongly
it's both
agree.
again mental and physical for us to let that go, let us be and to just ask for help.
Yes, let others care for us too.
So I'm curious, we have a lot of services in different languages as well, different Asian languages, because part of the access, of course, is the whole fear about the system itself. But once we decide to come in and receive the care, that a lot of people feel like, well, they don't speak my language. The physician isn't speaking my language. The nurses don't speak my language. All the paperwork is in English, and my parents speak a different language. So how do we navigate that and challenge that?
Yes. One, I would say we're lucky to live in California. We have a lot of rights. So actually, folks should not be showing up and engaging in the healthcare system and not finding someone who speaks their language or at least an interpreter line or printed materials and those what we call threshold languages. So, I like to be a little bit fiery with folks, which is like, that's wrong. That's not how the healthcare system should be functioning. And we should push the healthcare system if that's an experience folks are having. And so I'll use Covered California as an example, right? It's not just that we believe it's the right thing to do, which of course it is, but also it's the law, right? We have to be offering both verbal and written support in the languages that folks prefer. And folks get to tell us what that language is. And then the onus and responsibility is on us. And so we've got navigators, agents, enrollment partners across the state who absolutely are multilingual and speak everyone's preferred language. You can type in your zip code online and find someone who might be just in your neighborhood, might be someone you already know who's available to help you enroll in those programs. And then I think the next challenge for us is how do we make sure once you have insurance that you can find a provider who speaks your language and maybe, does have that shared cultural background and context? That's work for us all to do across the state of California. There is in some regions a little bit more. We just started to look at this data. It's so fascinating of
Mhm.
where our enrollees live, how they self identify, and then what the provider demographics are of our in network providers. And in some regions, it's pretty good. We got a match, right, for folks to identify as Asian
Amazing.
or Asian American. And in some, it's way off. Actually, in both directions. Sometimes more providers than population, and sometimes the opposite. And so
Uh-huh.
we really have sort of a maldistribution. And that's just work for us all to do across the state and in the policy world and in the workforce development world. So parts are working as pretty well. And I think parts we still have opportunity.
Yeah. And I think I love that you've mentioned that this is by law that they have the rights to be able to access care in a way that makes sense for them. Literally, that makes sense for them in their language, right? Because that puts a lot of mental load for I feel like immigrant families. They're, again, adult children are trying to seek help for their elderly parents and they feel the need to have to show up to their appointments every single time just to be a translator, right? And this gives a lot of less pressure to know that no, perhaps you can help them navigate through just making that appointment. But when they show up, all they have to ask is, this is the language I speak. That's all they have to say. Or by even from the get go, from the appointment, you just ask for that language to be spoken or have a translator for them.
This is critical. And, I'll just say it again. Imagine that, right? That just to be able to get your basic care needs meet, you have to engage somebody else in your family or in your community to come with you. I mean, that, like you said, that time burden, the cost burden, and the mental burden is sort of astronomical for that. So no, our healthcare system cannot be functioning in that way. And I am grateful that we have some of these rights.
I am as well. And I just want all of our listeners to know again that this is your right.
Yes.
What is an important Cover California update that people should pay attention to about healthcare coverage at this time? So this is May. What are we looking out for in terms of updates, dates, and things like that? I think it goes by so fast. Time goes by fast and we lose track. So what are we looking for here?
It does. It is wild that we're already entering summer. So, folks are probably tracking. There's been a lot of policy changes with the current federal administration, and some are still in flight. But one that has landed is that our open enrollment this year is going going to be shorter than it really ever has been before. And so it will start November 1st and it will end December 31st. So that's much shorter for us. So that means acting early is critical. If you are currently uninsured and wanting to enroll, if you're a covered California enrollee, if something's gone on in the background with your employment and you're going to be looking for a change in the new year for 2027, please look out for our information, coveredca.com. Also, you can kind of sign up and get information from us there. But that's the first thing is it's going to be shorter. We got to move faster. And then we do see that there are some pretty substantial changes around eligibility and enrollment. There will be a whole group of lawfully present immigrants who are not going to be eligible for federal subsidies or financial help this year because of policy changes. So that's starting in 2027. We're going to do everything we can to keep people covered, and we are flipping over sofa cushions, looking for pennies to try
Yeah.
to, wrap dollars around folks. But those are just the realities of what we're facing. Much, much more headwinds. And so, make sure your contact information is up to date. Coveredca.com, or talk to your local, navigator partner or enroller partner, just to make sure you're not missing anything that might be kind of hot off the press coming.
Thank you so much for giving us the just a real update, right? Also, I'm curious. I understand that if there's kind of a life change that people could be looking for before November, can you tell me a little bit more about that as well?
Yes, absolutely. So there's a whole list of, anything that might have happened in your life that qualifies you to come in the special enrollment period. So if you lost your job, if your hours changed, if you got married, if you got divorced, if you had a baby, if you had adopted a baby. So a number of different opportunities. So that's another one. If you just come to our website, you can check and see, does my life change actually qualify? Is that a qualifying life event? And then you can come on, and essentially at any point in time in the year and have coverage for the rest of the year, which is great. So it's a really important question. It's not just open enrollment.
Amazing. And then for those folks that are, because it's summer now, and then you had said wait till November 1st, in between now and then, if they are definitely knowing that they want to sign up with Cover California, what should they prepare?
Yes. Ooh, great question. So we want to make sure we have your income and your household size, especially anybody that might be coming onto your plan with you. So I think keeping that information at the ready, but really we just want to make sure we've got your email and your phone number accessible so that we can outreach to you. We believe it's our job to make sure that you know when things are open and it's time to come in and that we can help you through that process. So coveredca.com, at least make sure your contact information is up to date.
Amazing. I feel like there's a lot of support. And this is, again, another question from just our community members
Yeah.
that we receive a lot. For those folks that really aren't good at navigating the internet, and I know that, of course, the email, all of that, really
Yeah.
great for our most clientele, but their elderlies, not so much. Where can they receive the information?
Yes. No, I think that's a great question. We have got thousands of enroller partners across the state of California who do elbow support. These are folks who will sit next to you, will enter your information in the system for you, will help you figure out what's the right plan, how to make sure that the provider that you want to see is in the plan that you are selecting and that you're getting all of that financial support. And about 50% of folks do use, in the flesh, real human to support
Mhm.
them. So it's not just, right, our elderly or folks that are more tech challenged. This is a complex system and these are important decisions to make. And so we've got a service center, a phone center that's during open enrollment, open late hours and on the weekends. And then again, folks across the state and in community who are available. And so it's true that the easiest way to find that person is on our website. You can also call us. We got a phone number and folks can link you there as well.
Amazing. Yeah. And sometimes, I live in LA, so I'm fortunate enough to go to the different neighborhoods and I just see the giant to cover California logo on the windows. That's one way, you could just walk in and be like, hey, I saw that sign. I'm trying to get information about insurance.
That is exactly right. Yes. We have some good brick and mortars across. So
I completely appreciate how big these giant logos are on the windows, really.
I know exactly which ones you're talking about.
Well, I have just one last question for you. For our listeners, can you just leave one message of hope for our AAPI community members that are celebrating AAPI Heritage Month and Mental Health Awareness Month?
Yes. My one message is you're not alone and we are here with you and for you to keep you healthy and well. And I hope folks really believe that and know that, right? We ourselves are Californians who do this work for the love of other Californians. We're not an insurance company, we're state employees, and we get out of bed every day to help you stay well. So, please use us.
I'm sure the listeners love hearing that, right? Like that, yeah, you are all state workers at the end of the day, and you're here to help, really. Mm. Thank you so much, Dr. Soni, for joining us today and giving us so much knowledge about Cover California, and as well as just talking to us and acknowledging all the challenges that we're facing today.
Oh, thank you for having me, and thank you for everything you do every day for helping Californians as well.
Thank you. All right, listeners, this is the Yellow Chair Collective podcast again. And Dr. Sadi, one last thing. Of course, our listeners will be able to find out about the Yellow Chair Collective at yellowchaircollective.com. Where can they find out more about Cover California?
Yes, you can go to coveredca.com or you can call us 800 300 1506. 800 300 1506.
Amazing. Thank you so much.
Thank you.